So my name is Dr. Paul Jenkins. I'm a consultant endocrinologist, which is a specialist in endocrinology. I trained at Cambridge Hospital, Cambridge University, and then the Royal London Hospital in the East End, and then moved to St. Bartholomew's Hospital, which had a very strong department of endocrinology, and was there for almost 20 years. And then more recently, I've turned to full-time independent practice and have my rooms in central London. I've always been fascinated by the human body and the interaction of science and nature with it, and the idea of trying to help patients. And I knew, from my first year at university, I was trained at Cambridge University. In the first year there, that endocrinology and hormones was just utterly fascinating. The concept that these tiny concentrations of chemical messengers could affect some of the most powerful human behavior and the way we feel, and trying to learn more and more about that, both from a scientific perspective and implicating that into clinical practice. I think it's seeing patients from such a variety of different backgrounds and cultures and learning how theoretically the same diseases, illnesses, and abnormalities, hormones can affect people so completely differently, and resulting in such very different symptoms and signs, and then trying to put all that together with a sort of the combination of listening to patients and then the laboratory data to come up with a plan and explanation for it, and then institute the therapy to help patients get better. Fortunately, endocrinology is usually mostly is about quality of life, and in trying to improve quality of life, which can be very severely impaired by it, and then to restore that back to normal. I would like to think that patients value most from me is the ability to listen to them. It's always my first professor of medicine always told me, listen to the patient. And it's still so true. And just because maybe doctors don't always understand everything, and we have to accept that we're not perfect in our current science, it doesn't mean that to the patient, they don't have a very real symptoms. So I think it's trying to listen to them, to take an overall holistic view of what bothers them and what might be affecting them, and to put it all together in clear and easily explainable explanations. And secondly, also sometimes to just give things a try. Just because some patients' laboratory results might be in the normal range doesn't mean always that it might be normal for them. And sometimes patients do respond to a treatment of medicines, either to lower or to increase hormone levels. And you're very rarely do patients come to any harm from a trial of medication. And indeed, patients will usually tell you, if it's not helping them, then they don't want to take medicine just for the sake of it. Most of us want to have as few medications as possible. So I think the ability to try things, sometimes thinking slightly out the box, patients can value. And conversely, what do I value most from patients? Well, it's just speaking to them, being able to find out what troubles them, what bothers them. And the old adage, but it's still true for the vast majority of doctors, is there's great satisfaction in helping patients get better. And knowing that at the end of the day, you've done a good day's work and made numerous patients better. That's still a fantastic feeling.